Hi, I'm Robert Berenger. I'm talking with Dr. Brian Vries about end-of-life conversations among older LGBT adults. And we've been talking about how there's a different experience for older LGBT. And I was just wondering, what are the health consequences of having a different experience, of experiencing stigma?
A question like that is I think, similar to thinking of is the experience of later life or aging different for an LGBT person than it might be for a heterosexual person? And on the one hand, as a function of everyone aging, that there are many similarities. And so by virtue of the universalisms of aging, I think that the differences might be lesser. But what complicates that are the lifetime effects of stigma in a variety of ways too. So older LGBT people, for example, we've seen evidence of different experiences of mental health. Older LGBT people tend to have much higher rates of depression, higher rates of suicide ideation. Physical health behaviors, we find higher rates of smoking and alcohol use, I think both of which are associated with depression, for example, and stigma amongst LGBT older people. And similarly, some physical conditions. There's evidence of higher rates of different types of cancer, for example, higher rates of reproductive cancers amongst older lesbians relative to heterosexual women. And those higher rates of cancers really might have more to do with a greater likelihood of not having had children, not giving birth to children, which can be seen as a protective mechanism in certain kinds of cancer. But the stigma is really the root of all of that a lifetime of stigma has costs psychologically, which relates to the sort of physical behaviors and social behaviors like smoking and drinking, which then relates to other physical behaviors, not the least of which might be types of cancer, for example.